We are numbing my beautiful patient in anticipation of suture suspension of the midface and jowl. And this is a way to keep her nice and comfortable. Lidocaine is like Novocaine at the dentist's office, where it blocks sensation for a comfortable outcome. Here we're getting ready to do suture suspension of the midface and jowl for my beautiful patient. Suture suspension is a nice intermediate technique that gives more lift than injectable fillers, although not quite as much lift as surgery. And here we're inserting surgical sutures via a tiny cannula into the deep plane musculature of the face. And these sutures contain perpendicularly oriented rasps on them that gain purchase in the tissue, meaning that I can customize the vector of pull or lift used for the sutures. Suture suspension can be done in any of the following 4 areas: the midface, the jowl, which is what I'm doing right now, the neck, and the brow. And this is a perfect technique for somebody who wants more of a lift but is not quite ready for surgery. I would say the sweet spot for suture suspension is patients in their 30s, 40s, and 50s. Below the 30s, you don't really need this typically, and above the 50s, 60s, 70s, we start thinking about the need for surgery because there's more tissue laxity. So when we're doing suture suspension, the sutures each support 2.5 pounds of pressure. We're able to get a comprehensive deep tissue lift. And then the sutures are going to gradually disintegrate over time. They last for about a year, and as they disintegrate and diminish, they function as collagen biostimulating agents so that the body is able to produce its own natural, beautiful collagen to replace them. So there we go, we're done with that side. All right, here I'm doing suture suspension for the midface and jowls for my beautiful patient. We're getting ready to give her a beautiful deep tissue lift in these areas. All right, so we're going to clean off the face. So we've done suture suspension bilaterally for the midface and jowl, and you can see a nice immediate improvement in the position of the malar eminence, jowling tissue of the lower third of the face, and you can really see that her features are more contoured and lifted looking. This is a great way to create that feeling without adding volume.